Okay, here we have the drip chamber, the sliding clamp, the rolling clamp, and the lure end. Okay. What I'd like to do is, I'd like to hang the bag first. It's easier to spike it that way versus leaving it on the bag, and it's easier to primer it that way as well. We just pull this right off. Make sure not to poke the bags on the side or else it'll leave leaks, and we just insert it in like that. Okay. Okay, now we're going to go ahead and primer our solution. Make sure the chamber is half full and the lure end is always lower than the bag itself. And make sure there's no bubbles inside. We're going to go ahead and clamp it, re-clamp it, and make sure there's no bubbles. Alright, we're ready to go see our patient. Okay, Mr. Smith, how are you doing today? I'm alright. You afraid of needles? Just a little bit. Alright, let me explain what I'm doing to you, alright? First, I'm going to apply the tourniquet around your arm like so. And I'm going to feel for your veins. Find a good vein. It's always better to feel for it than looking at it, because a lot of times your eyes deceive you. So you feel for a little spongy material, which is the vein, and you don't want to insert the catheter anywhere near valves. Go ahead and prepare my material here. Okay, this is a very nice vein right here. It's very big and spongy. What you want to do is you want to wipe once to not further contaminate the area. Okay, when inserting the needle, you want to insert it at a 35 to 40 degree angle. And once you get a flash, which you can see in the tubing, you will lower the needle and advance it a little more. And then you can pull the catheter in. Okay. You always want to hold down the side of the vein so it does not roll. Okay. Once you get the flash, you lower it, advance it a little further, and we're going to pull the catheter in, advance it in slowly. Okay. You want to apply light pressure to the top so the blood doesn't come out. Then we're going to attach another piece to it. We're going to pull the tourniquet. Okay, what we're going to do now, it's called the Chevron Technique. We slide the tape under, and then we're going to go across, like so. Okay. Grab the other side, and we're going to go across as well. Okay. Alright, this is the Chevron Technique. Okay, another thing you can do besides the Chevron Technique is you can just apply the Tegaderm. Here we are. What you want to do is just center it. And you want to go from the middle outward so then you don't create any air bubbles. There you go. Alright, and then you just attach your IV tubing. Okay, once we apply the Tegaderm, we're going to attach the IV tubing set to it. Okay, and we're going to check for patency.
Make sure it's dripping.
And it's dripping. Okay.